Well, good evening, everyone, and welcome to the Central and Eastern Sydney PHN presentation on how to manage access to the My Health Record program and how to download your Nash PKI certificates via PRODA. So what we're going to talk about tonight should be of benefit to any health professional or practice manager who wants to know how to manage their links for My Health Record in terms of staff, so linking up current practitioners or removing previous practitioners, and also anyone who wants to download or request a new Nash PKI certificate online. My name's Nerida. I am a part of the My Health Record expansion team with the Central and Eastern Sydney PHN. I've also got Raj here with me, and Raj is one of the digital health team from Central and Eastern Sydney PHN. So as I just said, this presentation is mainly going to focus on providers who are already registered for My Health Record. That would mean you already have an organisation identifier, and also known as an HPIO, and then you may need to update your Nash PKI security certificate. It's possible you might also need to update your Nash PKI certificate to be able to use your secure messaging program, and this will show you how to do that through PRODA as well, even if you're not actually registered for My Health Record. If you do wish to get registered as an organisation for the My Health Record program, you can do this via PRODA, but we're not really going to discuss that tonight. We do have a previous webinar which you can get the slides of or watch, but also if you wish to have any assistance in getting registered for My Health Record, please just contact one of the staff here at the Central and Eastern Sydney PHN, and we would be very happy to come out and help you. Of course, as well, if you have any other needs or need any other assistance in terms of any of your digital health or My Health Record use, please do contact us because we're very happy to come out and assist you. For tonight's presentation, as we go through, if you have any questions, we just request that you write them into that chat box. The questions will come directly to us. We will do our best to answer them if we can as we go along. And there will be also some time at the end to ask questions if anyone has any questions. If you're not quite sure where to find the chat box, the screen should be showing now with a black box, and you should be able to see that black box or a similar black box somewhere on your screen right now. You can get the chat box up by clicking onto that chat icon where the arrow is. If you send out a message via the chat, it will flash up orange on the icon. Sorry, if we send you a message during this presentation, it will flash up orange, and that will say to you that there is a message. For example, when I said a message earlier tonight that this presentation was going to start at 6:30, you may have seen that flashing orange box. So just to start off, if everybody could please type into that chat box your name and the practice that you're representing, and that's just for our attendance information. So that information will only come to me as the host. It's only shared with me. Thank you. If everyone doesn't mind just typing that in. In the meantime, I'm just going to briefly explain some of the identifying numbers and the abbreviations that are associated with those. And these are the information, the identifiers that you need to know how to access a My Health Record for a patient. So there's 3 of them. The organisation where the service was provided, obviously generally that's going to be your particular medical practice in this situation. So that organisation needs to be registered and has its own identification number. That's known as an HPIO, the Healthcare Provider Identifier Organisation. Then within the organisation, each individual provider, so every healthcare practitioner, whether that's a doctor, a practice nurse, or some allied health providers that may work in your practice, each individual will have already been assigned their own HPII and that stands for Healthcare Provider Identifier Individual. So generally that number is linked to each healthcare provider's AHPRA registration. If the healthcare practitioner is not AHPRA registered, and some professions at the moment are not, such as dietitians or speech pathologists, but they still can get an HPII. They just have to fill in a different form. However, in terms of what we need for tonight, you'll just need to make sure that if you're going to link individual practitioners to your organisation, that the practitioners provide you with their HPII. And the third number and abbreviation there is the Individual Healthcare Identifier, IHI, and that is for each patient. That's linked to their Medicare number. It's not their Medicare number, but it is linked to that. And once we have those three different identifiers, it's quite important that we have all of those available. And then if a healthcare event, if a summary is to be uploaded or you need to access a My Health record, you'll be able to do so with those three numbers in place. So now we'll get down to what we really want to speak about tonight. And a lot of that is about PRODA. What is it? How do you log in? How do you register? And what can you do on there? Hopefully most of you will have already heard about PRODA. It stands for Provider Digital Access. It's a Department of Human Services website. And it's now the recommended way to access the Health Professional Online Services System, or HPOS system. So there might be lots of reasons that you will have used HPOS, or you are using HPOS. Some of those are listed there on those slides. If you need to check a patient's Medicare details, you can do it through HPOS. If you need to check claiming eligibility for MBS item numbers based on previous claim history, you can have a look at that there. You can check care plan history. You can run through claims for DVA or for NDIS. You can look for current authorities or request an authority on the online PBS authority part of this. You can check the Australian Immunisation Register. You can do more things. There's some of the practice incentive payments. So there's a lot that can be run through HPOS, and this is now recommended you do this via PRODA. Previously, you may have accessed HPOS using your individual Medicare PKI certificate. That's a piece of physical hardware, generally a USB stick, and that was assigned to an individual person or practitioner, and you needed that to be able to sign in. The department is switching over to PRODA partly because of security, so there isn't any physical item that someone can get their hands on. But it also will mean that you can access this in more mobile locations. You won't need any kind of hardware. You'll just need an internet connection, and you'll need to have your password details. It is quite secure because they do a two-step authentication process to be able to log in. If you have those individual PKI certificates, at the moment it looks like they are going to be gradually phased out by the end of 2020. So we are recommending, if you haven't already, to get registered and get signed up to PRODA so you can manage all of this via PRODA. So as I said, hopefully you might already have a PRODA account, which makes all of this a bit easier. If you don't have one though, it's quite simple to register. You go to the website, and that website is PRODA, P-R-O-D-A, .humanservices.gov.au, and you follow the steps to register. The registration process does require proof of identity documents. It's similar to a 100-point bank identity check, so you'll need to provide sufficient documentation. Generally, that would be a passport, a driver's license, and a Medicare card. However, there are other forms of identification which are acceptable, and you can find those online on the website. You don't have to provide copies of the documents, but you do need to have them with you because you'll need to be able to enter the numbers of each document for the online verification process to take place. The registration process will also link you as an individual to your professional identifiers. That might be your APRA registration number or your provider number. In the case of My Health Record, if you have already been made the responsible officer, or RO, or the organisational maintenance officer, which is the OMO, for any healthcare provider organisations, it's also worth linking your RO or your OMO number. And actually, that's quite important for tonight's processes that we're going to be discussing, because in terms of who can request a new Nash PKI certificate, only the RO or the OMO for an organisation can do that. So it is quite important that in PRODA you link all of that up so that it's clear that you do have that authority for the organisation to order the new Nash PKI certificate. So when you are registering for a PRODA account, just be aware and be careful that the name that you apply for your account in is your individual name. It's not in the name of an organisation. If you've signed up for PRODA, there is also a possibility, if you want to prove that you are a person who makes decisions for a certain organisation, so that might be proving that you're the owner or the manager. If the Department of Human Services is not already, if you're not already known to them in that practice, such as you're not the person listed on the Australian Business Register, you will need to provide suitable documentation to provide proof that you really are the person who can make the decisions for that business. So that may not happen for all cases, but there might be some situations where you would have to provide some documentation saying that you were the owner or the principal person of that practice. Okay, so we're going to assume that we've all got PRODA accounts now and that we log in. So when you do log in, it is a two-step process. You put your username and your password, and then you will have a code sent to your nominated email or to your nominated telephone number as an SMS. You set that up when you first set up your own account, so you can have either. And then once you've entered the code, you'll come through to the home page. It will look something like this that's on the screen. It may vary a little bit depending on what you have linked up to your PRODA account. For everything that we're going to talk about tonight in terms of managing links for an organisation or downloading, requesting Nash PKI certificates, then it's going to be through HPOS, that Health Professional Online Services tile that is circled there. And just remember, if you want to do that Nash certificate, you must be the RO or the OMO that is managing this. If you are the owner and you actually don't want to do admin and you want to put someone else on as a responsible person or a maintenance officer, then you can add OMOs, and this can also be done through here. We'll show you this later on. So you click through there onto that tile, Health Professional Online Services. It actually should show us that two different parts of it. So initially what we want to do is we're going to make sure that the person who's logged in is linked to the correct organisation you're requesting. So first of all, we're going to click onto that link identifiers there. Then you get this screen. So that drop-down box that is circled allows you to change identifier type. You could also put your HPIO in here. So that is the organisational identifier, and that will make sure that everything is running smoothly. And it is recommended that you choose the RO/OMO and you put in your number there. If you don't know your RO or OMO number, you can call the Healthcare Identifier Service, and their telephone number is 1300 361 457. So they'll be able to help you out with that. If you're a registered health professional, it's quite likely that your RO or your OMO is going to be exactly the same as your HPII, your individual healthcare provider identifier. But if you're not a registered health professional, if you're the practice manager or in other types of admin, if someone has nominated you as an OMO or an RO, you will have been assigned a specific 10-digit number, and you might need to find that out from the HI services line. So once we've made sure the RO and the OMO are linked, you can continue on. So you actually need to go back to the first screen that we saw, and when we click on that tile, instead of clicking on link identifiers, click on go to services. So once you go into the services from the HPOS box, this is what you get. So you go from there onto my programs. And again, once you go through my programs, something like this screen should appear. So you may have different tiles depending on your organization and perhaps what different parts of the claiming and things you're managing through your organization. For what we want to look at tonight, and this first one we're going to look at is to download and request and download a new Nash PKI certificate. First of all, we click onto that healthcare identifiers. We get this screen. We choose my organization details, where the arrow is. And this is what comes up. So you can see along the top there's lots of different tabs. They all hold different information. For the Nash certificates, we want to go to the far right-hand tab where it says certificates. And you will get a screen something like this. This is a snapshot of my own PRODA account and my own organization. I don't have any certificates, so that's why that doesn't show up there. If I needed to request one, I would click onto request Nash PKI certificate to the bottom there with that arrow. From there, we go to this screen. So we fill in the necessary information. Obviously, you put a mobile phone number there. You can put anybody's mobile phone number. It doesn't have to be the owner, but whoever puts their number there will get the one text message saying that it is ready to download the new Nash PKI certificate, and will also receive the personal identification code, which is like a PIN code, and is texted to your mobile that you enter there. Obviously, it's important that the person who's going to get that text is in the country or in service. Otherwise, you won't be able to access the certificate. As well as entering those phone details, you just need to check that box to say if you've got an existing Nash certificate, you agree to it being revoked, and then you save the changes. Once it's all saved, something like this similar comes up, and you just submit your request. So the official time frame for a new Nash PKI certificate to be available is within 1 business day of the request. However, the digital health team have told me mostly they are getting these certificates sent through to the practices within 15 minutes to half an hour of the request. So it does happen quite quickly. But whenever you get that, however it comes to you, you will get that text message sent to the number you provided, and it will just say your Nash certificate is ready and that your PIC is whatever that code will be. So once that's come through, any individual that's linked to your organisation will be able to see and download the Nash PKI certificate. However, only the person who got the text message will have the code, and that code is necessary to install it. So once the Nash certificate is available, it will remain there and be able to be downloaded for 30 days. So you only have 30 days to download your certificate and get it installed. when you go back to go and download your Nash certificate, you have to go back through the process we went through before in terms of logging in, going to my services on HPOS, my programs, healthcare identifiers, choose your organisation, click through to certificates, and this is similar to what you would see. So you can see there it says download certificate. Basically, you just download it. Once the Nash PKI certificate is downloaded, then you can import that into your clinical software. So if you're not quite sure about how to do that or not confident, you can either contact your clinical software provider or your IT support team if you have an ICT support team. Or, of course, you can also contact us here at the Central and Eastern Sydney PHN and get one of our friendly digital support team to come out and assist you. So at the moment, the Nash PKI certificates are expiring every 2 years. And so this is how the Department of Human Services are eventually it's going to be the only way to be able to get your Nash PKI certificate through PRODA as a download. As well as contacting us if you need any assistance. The other people, if you need some support that might be able to help, is if you actually contact PRODA themselves. So their telephone number, if you need some support, is 1800 700 199. And they should be available Monday to Friday, 8 till 5. Or you can even email them at proda@humanservices.gov.au. So that covers how to download the Nash PKI certificate. As I said before, there's a few other things we can manage through here for My Health Record, and they're still quite important. And one of those is basically managing organisation registration and making sure that any new practitioners that are in your medical practice or anyone who's left your medical practice, that's kept up to date. And you can do this via PRODA, and again, it's recommended to do it through here. So it's actually a requirement for accreditation that all practitioners, and that includes your GPs, your RNs, your allied health, but anyone who's currently working in the practice needs to be linked to that organisation. So each individual will need to provide their HPII to whoever the person is who's going to update this, whether that is the practice manager or the owner. But each individual will need to provide their HPII. So once we go back out in HPOS, go to My Programs, this time we're going to click onto the box that's circled there, which is My Health Record System Organisation Registration. That takes us to this. So we just click onto Manage Authorization Links and you get a screen something like this. So this is my own. So I have just blocked out some of the details, but you will see your organisation name and the address of the organisation. And this allows you to do all sorts of things. So you can link healthcare service providers or contracted service providers to your organisation. Potentially, you could also remove people who are no longer with your practice. Just be careful if you personally, as an individual in your PRODA account, have been linked to a number of different organisations. Maybe you're the practice manager across 3 or 4 practices or an owner across a number of practices. When in that situation, when you come to this screen, you will see probably all the practices that you're associated with. So you just need to make sure you click onto the right one. So we click through Add Update Link. And as you can see here, there's either 2 ways to do it. If you want to enter a new person who's not currently linked to your organisation, you just click on the Enter HPII or the CSP number. And obviously you enter the HPII. And likewise, if you want to take someone off, if you've got a practitioner who's no longer working with you, you just select them from that list, which would be underneath listed providers, and you deactivate their link. Again, if you have a large number of practitioners, you just need to make sure that you're selecting the right person to deactivate. So as I said before, that's a requirement for your accreditation to keep this up to date, but also for My Health Record, it is recommended for security purposes. And of course, you don't wish to have a situation where a practitioner accesses someone's My Health Record and is saying it's through your surgery when actually they're not working there anymore. So just keep all of that up to date. The third thing that we can show you here that you can manage through PRODA is if you do want to add an additional OMO or an organisational maintenance officer. So you can do that through here as well. That might be perhaps if your normal manager is going to be away for a long period of time or is leaving, you might want to add somebody else on to an OMO. It's a little bit strange because you actually have to click on that tile there that says Register Seed Organisation. That's regardless of whether you're already registered for a My Health Record or not. Just click onto that one. And here we go, we get the seed organisation information up. You just need to put your ABN or your ACN in the box, submit it, and the information will pop up. And again, this is regardless of whether you are actually registered for My Health Record or not, because if you're not already, this is how you can get registered for My Health Record if you wish to. For today's purpose, we're just talking about adding that extra OMO. So the tab there on the right, at the far right, is how to add an additional OMO. And this is probably recommended if you don't already have someone set up or you want to change it. So you just fill that information in and submit it, and that should then allow a new OMO to be added onto someone's record or an organisation's record. So that concludes the bulk of what we were going to talk about tonight. Hopefully that's been reasonably simple for you to understand. But again, if you've got any questions, please write them into the chat box now, because we're very happy to answer anything that might not be clear or you need any assistance with. We don't seem to have any questions, which hopefully is good. Hopefully that means you got out of this presentation what you would like to have got out of it, and that you feel confident in doing these tasks in terms of downloading and requesting and keeping things up to date through PRODA. But as I said before, if you need any more assistance at all, whether that's information about My Health Record, information about secure messaging, or even about things we haven't talked about or covered tonight, but information about POLA or any of the other programs through the Central and Eastern Sydney PHN, please just contact us. You can either email digitalhealth@cesphn.com.au, you can phone the number on the screen there, or of course if you've got any one of the team's individual contact details, you can also contact them, and we'd be very happy to come out and assist with whatever we can in terms of any kind of management, downloading, adding setting up a PRODA account, anything like that. We should be able to help with you. Okay, so thank you very much. If there's no further questions, which it doesn't look like, then we'll conclude this presentation for tonight, and we thank you for attending. Thank you.